Hi, I'm Dr. James Meschino, and if you're between the age of 45 and 49 and you're a man, there's a couple of things I want to point out to you that are vitally important. The first one is that you have to be protecting your prostate gland. I'll explain that. You need to protect your joint integrity. We're going to talk about how you do that. And you also have to stop the power shortage, which is now underway in your body. I'm going to explain that as well. So let's start with prostate health. At the age of 40, something starts to happen in the prostate gland that maybe you're not quite aware of just yet. And that is that the prostate starts to build up more of a dangerous type of testosterone. It's called DHT. DHT causes the cells of your prostate to divide at a faster and faster rate. As they do that, the prostate gland starts to enlarge. And 90% of men will end up with prostate enlargement problems if they live to be 80 years old. But even more serious than that is that when the prostate cells are dividing faster and faster, they make more genetic mistakes that can lead to cancerous mutations. So it's vitally important to slow down the rate at which your prostate cells are dividing. There are nutrients that can do that, nutrients that can block the buildup of DHT and slow down the rate of prostate cell division. It's critically important. Those nutrients are natural things like saw palmetto, Pygeum africanum, beta-cytosterol, stinging nettle, and soy isoflavones, a series of nutrients. I created a formulation called Prostate 40 Plus that puts those nutrients together at dosages that have a meaningful effect that can actually protect the prostate gland in a very significant way. So at age 40, that has got to be a primary consideration for you. You also have to protect your joint cartilage. As you get older, after the age of 40, your cartilage starts to thin out and it leads to arthritic changes later in life. Why is it happening? A major reason is because the body doesn't make optimal amounts of glucosamine anymore. You need glucosamine to maintain your joint cartilage. We know that taking glucosamine as a supplement can give the body the glucosamine it can't make for itself to protect your joint cartilage. The other thing is that the cells in your joints start to make more inflammatory chemicals as you get older. So it leads to more joint inflammation, pain lingers to a longer degree, joint stiffness sets in. Glucosamine alone can't tackle all of this. You need natural anti-inflammatory agents like MSM, quercetin, bromelain. They can help. So in the joint cartilage supplement that I created, the formulation that I created, glucosamine joint formula, you get the glucosamine as well as the MSM, the quercetin, and the bromelain. They work synergistically to maintain joint cartilage health and joint health overall. Now at age 45, this next time bomb that goes off is really important. The body stops making optimal amounts of CoQ10. You end up in what's called a power shortage situation. Because to convert food into energy, you need coenzyme Q10. As we run out of it, there's like a piston missing in the engine. The cells can't make the energy that they require. It really affects the heart muscle, the brain, and the immune system. In the heart, as the heart pump gets weaker as a result of this, it can lead down the road to congestive heart failure, even high blood pressure. The good news is that studies have proven that if you put CoQ10 back in, you can put the piston back into the engine, optimize energy so you don't feel as tired, but it helps to protect your heart, particularly over your lifetime, from the weakening effect that would otherwise occur. But CoQ10 works best with an herb called hawthorn. Hawthorn and CoQ10 work together to maximize energy production, particularly in the heart muscle, and hawthorn has some secondary benefits. It opens up the blood vessels in the heart area, in the coronary vessels, to improve blood flow to the heart muscle. That's extremely important for the prevention of heart disease. It also can lower blood pressure if your blood pressure is starting to rise. Sometimes has very nice blood pressure lowering effect if you're having that kind of a challenge. And so the formulation that I created called Cardio Essentials contains the optimal combination of CoQ10, hawthorn, and also another agent called quercetin, which puts out inflammation in the blood vessel wall. All of these things are vitally important as anti-aging, healthy aging supplements. Now, of course, throughout all of adult life, you need a high-potency multivitamin because you need to get the antioxidants associated with that. The reason being, of course, is that there's free radicals all around us. Free radicals are damaging our brain, damaging our skin, damaging our genes, creating cancerous mutations, damaging our eyes, leading to cataracts and macular degeneration, weakening the immune system. So people know that antioxidants are important. You know you need extra B vitamins for your brain to think and for energy, for red blood cell production. And most, even men, develop bone density problems as they get older. So I created a formulation called the Adiva Multiple Vitamin and Mineral. That formulation has everything from A to zinc. It's antioxidant enriched, has the extra B vitamins, the bone density nutrients. So you have it all in one. And of course, the final thing throughout all of adult life is the right essential fatty acid supplement. The right combination is borage seed with flaxseed with fish oil all in one capsule. The reason that's important is because those particular oils come together so your cells can make the hormones that are vitally important to reduce inflammation, maximize the improvement of blood flow to reduce risk of cardiovascular disease. They also make your skin soft and smooth, and together that combination slows down the rate of cell division. So that combination of essential fatty acids, which I call nature's essential oils, is another lifelong strategy. So to summarize, for men between age 45 and 49 years old, the 4 foundation supplements are the Adiva Multiple Vitamin and Mineral, Nature's Essential Oils, Prostate 40 Plus, Glucosamine Joint Formula, and there's a 5th one now, Cardio Essentials with the CoQ10, the Hawthorne, and the quercetin. You can learn more about these formulations on the website, but these are critically important for you to know about. Thanks so much for listening.